Cascade screening for inherited conditions. Section 1. The case. Who, what, and why. You are settling into another day of work at your family practice office. Next on your schedule is a family appointment, where they want to talk about a letter they received about a newly diagnosed genetic condition in the family. The father explains that his brother was recently diagnosed with hypertrophic cardiomyopathy, and that his father died of a presumed heart attack at age 40 years old. He now wonders if this was the cause of the sudden cardiac death of his father. Based on what they read in the letter, he is worried that his two children may have hypertrophic cardiomyopathy as well, and would like his children to get tested for the gene variant found in their family. Hypertrophic cardiomyopathy, or HCM, is defined by the presence of left ventricular hypertrophy in the absence of other cardiac or systemic disease. Common symptoms can include shortness of breath, particularly with exertion, chest pain, and palpitations. However, sudden cardiac death may be the first manifestation of disease, making it difficult to diagnose and treat. HCM is most often diagnosed in adolescence by either echocardiography or cardiac MRI. The condition of HCM is often caused by pathogenic variants in genes encoding for components of the sarcomere, and is inherited in an autosomal dominant manner. Genetic testing using multi-gene panels is recommended to confirm the diagnosis of HCM. So, who should be offered testing? Who is the best person to test first? Is a genetic test the best way to look for this condition? And how does this inform treatment? In this video, we will cover the following topics to support cascade screening using a case study to help you face these types of questions from your patients and determine how to facilitate genetic testing if desired. Number 1. The purpose of cascade screening and its power in preventative medicine. Number 2. Who should be offered testing and in what order? Number 3. How to support your patients in their decision about cascade genetic testing. Section 2. The purpose of cascade screening using genetic testing. Genetic testing is often a piece of the puzzle in the diagnosis and management of inherited conditions and can be done for a variety of clinical situations. These tests may be done to support a suspected or known diagnosis or help choose appropriate medications and dosing. We can also use genetic tests to determine whether individuals may be at risk for developing a disease in the future. Furthermore, testing can determine if patients carry genetic variants that could be passed on to future generations. Genetic tests may be broad or targeted, and check single genes, groups of genes, or just look at one or a group of gene alleles, depending on the test's purpose. Genetic test results not only apply to patients, but they may also apply to their close family members. Diseases with a genetic component are inherited in families in predictable ways. For example, with autosomal dominant conditions, we can expect that if one parent is affected, each child will have a 50% chance of inheriting the gene variant and be at an increased risk of developing the condition. However, the signs and symptoms may look different between patients with the same inherited condition, and can even look to skip a generation because the symptoms are so mild. This makes it even more important that close relatives of someone with an autosomal dominant condition be screened, regardless of their current health status or age, so that they can get timely care. Cascade screening is where family members of someone who has received a new diagnosis of an inherited condition, a proband, are given the option to be evaluated to see if they have or are at risk for the same condition. As a result, cascade screening is best done in a systematic approach, starting with testing first-degree relatives and following the positive results when progressing to relationships that are further out. The use of genetic testing for cascade screening is a powerful public health tool because it can help identify individuals before they present with symptoms and allow them to access preventative treatment. Genetic testing can also liberate some family members from the burden of thinking they have an inherited condition if they test negative for the condition. This can save them or their offspring from having to declare a family history of a condition on their insurance or unneeded screening for their lifetime. Section 3. Considerations of cascade screening. Before we start our case, there are some important things to remember discussing with the patient before they make their decision about cascade genetic testing. These include, when is genetic testing the best method to screen for their condition, and when is it the best time to do so? How can these results change or not change patient care? How do these results impact insurance considerations and potential for discrimination? And does this impact how they manage their health risks in future family planning? These conversations can be complex and may necessitate a referral to a genetic counselor. Genetic counselors are healthcare professionals with advanced training in medical genetics and counseling to guide and support patients seeking more information about how inherited diseases and conditions might affect them or their families. Genetic counselors can meet with individuals or families before or after genetic testing. A clinical example of the power of cascade screening. Let's go back to our case where someone in the family has been diagnosed with HCM. While cardiac imaging is commonly used to screen and diagnose HCM, We know that a genetic test is the best way to screen right now because a family member has a letter describing a molecular diagnosis in a first-degree relative. While it is understandable for parents to worry and put their children's health first, it is important to test the closest relative to the affected individual. To prevent unnecessary tests and better understand how the variant has been passed through the family, you recommend testing the father of this family and then, depending on the results, determine if testing is required for the children. You also explain that screening now means having better information to manage the patient's care. If the father is found to carry the gene variant, then routine screening can begin to monitor for any signs of HCM. If they do not carry the variant, then screening is not required and there is no need to test the children, as they are not at risk of inheriting a genetic variant or developing HCM. While this family doesn't appear to have any concerns about discrimination, you explain to them that some people are worried about the fact that insurers, employers, and doctors may treat them differently because their genetic test results may reveal a risk of developing a condition in the future. You confirm with them that the Genetic Non-Discrimination Act, or GNA, was created to remove barriers to the appropriate use of genetic services by the public. It protects individuals from the use of genetic test results outside medical care and medical care research, including insurance and employment. This policy may help guide their decision to pursue genetic testing. It is also important to share that genetic testing may change a patient's emotional status and life plan, both for positive and negative results. They may pursue different careers based on the knowledge that they are at risk for the condition. It could also change their overall health choices, including the activities they participate in, and be a consideration for future family planning. These patients were keen to follow up with this news of a possible inherited condition, but many patients may not be comfortable sharing their genetic test results with family members, possibly preventing them from being tested. Similarly, at-risk family members may be adverse to testing, which may leave them and their children in the dark about potential health risks. If your patient does not want to tell their family members, the current standard practice is to maintain confidentiality. If a situation arises where you believe you must report the result to family members against a patient's wishes, you can contact your professional association for guidance and advice. Talking further with his family, the father agrees to get tested. You refer him to the Inherited Cardiomyopathy Clinic with all of the necessary information and explain that there will also be an opportunity to talk with a genetic counselor if there are any questions that the family has about the implications of their result on future family planning and risk reduction in individuals affected. Section 4. Outcomes of Cascade genetic testing. There are a lot of factors we have to consider when applying the genetic test results for a patient to their care plan. If the father does carry the variant, he would be referred to a cardiologist to begin routine screening to monitor for any signs of HCM. If asymptomatic, he can make lifestyle changes and diet changes that may prevent him from developing the condition, and if diagnosed with HCM, knowing the variant may influence treatment options to manage the condition. This would also begin the conversation of cascade screening in other family members, including the children. For the father in our case study, if he does not carry the variant, then his risk of cardiovascular disease is the same as an average person with his lifestyle, and there is no need to test either child as they are not at risk of inheriting the variant or developing HCM. You think about how a family history might impact other members of your practice, including those that have a diagnosis or condition that runs in their family, a child that has multiple anomalies in areas of growth and development, or a patient that has troubles getting pregnant. You then consider whether you should refer these patients and families to the relevant clinic for genetic assessment. Ultimately, the decision to pursue genetic testing is very personal, important, and challenging for patients. Let's leave you with a few final questions. When do you think someone needs genetic assessment and testing? And how would you use this information in your practice?